Welcome, everyone. We have a very large crowd on the webinar today. I'm zooming in from San Diego, California, and I know as our client base is both domestic and international, we have folks. So it's good evening, good afternoon, good morning. We're all over the place, and I'm so honored to be joined this afternoon by Sergey Young, who's become a friend. We've traveled together, we've given talks together, and we share, a vision to evangelize and socialize and communicate the art and science of longevity together. And I'm just so proud that we can be joined today by Sergey, to get his insights on longevity and performance in general, to hear about the latest in terms of longevity investments, and also Sergey to hear about your book. For those of you who don't know Sergey, he founded the Longevity Vision Fund in 2019 to invest in leading biotech companies targeting the underlying causes of aging. He serves on the board of directors of the American Federation of Aging Research, innovation board member at XPRIZE, and is one of the co-creators of HealthSpan XPRIZE global competition designed to reverse aging. So Sergey, welcome. And of course, you're also the author of the best-selling book, The Science and Technology of Growing Young, which is what we all want to do. So welcome. And with that, Sergey, I'd just let you introduce yourself as well to our ecosystem.
Hi, everyone. I'm so excited to be here. I'm actually calling in today from my hotel room in Boston, from the biotech capital of the world. We spent a day here at MIT. We spent some time with David Sinclair. We see some of the companies who just went out, from George Lab tomorrow, and George himself. So this is exciting time. And let's spend first 20 minutes on what I call the 7 signs of longevity revolution. What is happening around us? Before that, I should say I'm very happy and healthy client of human longevity. And, I've been doing medical screening at human longevity, I think, for the last 5 years. And this is very exciting. It's an opportunity for me to pay back to the organization who saved so many lives, and I'm so excited to do this presentation and this Q&A with our audience. David, is everything okay with the audio and video and presentation?
Yep, looks great, Sergey. We can see your 7 signs of longevity revolution.
Beautiful.
Great, yeah.
Okay, so just a sec. Yeah. So who is Sergey Young? And thanks for introduction, David. I've been investing for the last 20 years. And it's funny, when people would always ask me, like, Sergey, how you developed this interest in health and longevity? And what I realized, in 90% of cases, like the people that I know, it took a personal health crisis to realize that there's something called health that you need to manage, you need to be interested in, you need to take back control of this. So, and then it's a little bit like with crypto. I mean, you can read articles for many years, or you just buy your own Bitcoin, and then your learning goes under your skin. So I thought, I'll just set up relatively small investment fund called Longevity Vision Fund, which would invest in a different technology, support scientists, entrepreneurs, of bringing affordable and accessible version of longevity to the world. And it's $100 million fund. We invested in 18 companies, but for many years, we've been one of the few longevity-focused funds in the world. So it was the most rewarding time in my life. I'm also on the board of XPRIZE Foundation, Pro Bono Foundation, and we're going to launch something which is called HealthSpan or Age Reversal XPRIZE competition by the end of this year. It's going to be at least $100 million in prize. This is all pro bono. We're going to see 300, 400, 500 teams all around the world competing to win this prize, and it's going to be more than one finalist, obviously, because human biology is very complex. But what is exciting for me is the fact that I was the one who just helped design the initial setup for this this competition, And you'd be surprised what are the rules of the game. So the winning team would need to reverse aging in a group of people who are 65 years and above by 20 biological years in the course of 12 months. I know it sounds crazy, similar, when we established Longevity Vision Fund or Human Longevity was established, people thought it's just crazy to work on this premise, but hopefully we'll have, in the next 3 to 5 years, we'll have a solution which goes as deep as reversing decades of our biological age. I obviously do support a lot of scientific endeavors all around the world, mostly in the US. And I'm, as David mentioned, I'm the author of the book called The Science and Technology of Growing Young. It's actually one of the chapters in the book starts with my journey to human longevity for the medical screening. So 3 slides for the context, and then we go into the 7 signs of longevity revolution. So when something is happening, and obviously we see this, breakthroughs and revolution in our ability to manage aging, I'm always trying to look at this from 2 perspectives. So one, what is the problem? And the other perspective, do we have something to solve it? So we all heard about what the problem is, and it's called silver tsunami. So today we have 1 billion people on this planet who are 60 years old and above. In 15 years time, it's going to be 2 billion people. And by 2050, it's going to be 3 billion people, almost half of the population of the planet, which is going to be 65 years and above. And obviously, because of the current demographics, the reproduction rates are well below 2.1 kids per couple, which is needed for population growth everywhere, with exception of African continent. We don't have any other choice rather than improve the quality and quantity of years of lives of people who are 45 years and above. So that's a problem. How are we trying to solve it? The good news, finally, through the whole history of human race, we have something which can appreciate and solve complexity of human biology, and this is called machine learning and artificial intelligence. And this is great. That's why we, look at this. We have so many scientific breakthroughs and technological discoveries in the last 10 years, which actually absolutely change our ability to think about aging, but also reverse aging by itself. We all know this is a problem. That's why we all here on this call today. That's why we, in one way or another, connected to human longevity. In a nutshell, starting from age 40 or 45, aging processes starts to build up in your body, and we all running the exponential risk with 90% probability with the age of 50 and above to die from 4 main diseases, which is cancer, neurodegenerative diseases, heart disease, and whatever we can combine in diabetes and metabolic diseases as well. So if we will be able to reverse our biological age, obviously this will decrease substantially our mortality risk, but also will improve the quality of our life. And this is the right time to invest your time and probably your money and the focus of your attention and your discipline into managing your own health, because for the last 10 years we had the investment in longevity research and longevity technologies increased by tenfold at least, and we have many bright minds and great people of this planet investing in this field. So, well, let's talk about what I call the 7 signs of longevity revolution, and they all predictive and reflective of how our life and our ability to manage our health will look like today and in the future. And so the first sign is literally about biosensing and about different wearable devices. Just a few years ago, I mean, if you would wear an Apple Watch or Garmin, this would basically will be super helpful to measure your athletic performance or like number of steps you do in a day. Well, it's not anymore. Oura Ring, Apple Watch, Whoop, whatever device you like, it basically became our personalized healthcare devices. So that's why my advice to everyone would be, pick up your own wearables, establish relationship with this, and see what is happening. Today and in the next 5 to 10 years, we're going to see a revolution in terms of our ability to measure performance of our body. And this is essential part. So medical screening is not going to be only one time a year. It's going to be continuous, in between your visits to Human Longevity or any other center which do the comprehensive checkup. And I always use Apple Watch as an example, but feel free again to use your own wearable provider. Apple Watch, Apple is super invested now in healthcare, and probably by the end of this decade, Apple will get 50% of its revenue from healthcare. So Apple Watch right now can do electrocardiogram, can detect 5 different types of heart arrhythmia. It has your medical ID. If you fall down in the street, it can call ambulance and let your relatives know. And you've obviously seen a lot of different features added to that. On the right side of this slide, you can see this beautiful wearable. It looks like continuous glucose monitor. It's a company which is actually based in San Diego, where Human Longevity started, a company called BioLink. They developed a non-invasive device, so it's microneedling, which can already today measure up to 7 different health biomarkers, including our hormones like cortisol, ketones as well. And I can go on and on, but in a nutshell, again, it is very important to use the benefit of wearables. And, like, for example, in my case, I use Apple Watch during the day. I use Oura Ring because it doesn't have display to measure my sleep, to establish this continuous feedback loop for improving your practices and lifestyle. Well, the sign number 1 is about artificial intelligence becoming a better doctor. Obviously, it's going to be combined. The human intelligence and artificial intelligence going to be combined. So it's not either or. But I'm very happy to report that I think for the last 3 years, I've done medical screening. It was first AI after full body MRI that we do down in San Diego, which reviews the scans and gives you the information about your risk of early stage cancer. And this is really important. And I was so impressed with these figures. Human doctor plus AI can detect early stage cancer in up to 99% of cases. And the same human doctor working under time pressure, and that's unfortunately reality of their job, can detect again early stage in less than 50% of cases. And moreover, AI gives more opportunity for doctor to patient connection rather than spending time on reviewing the scan and looking at the risk as well. Well, the company on the right side of the slide is actually a very interesting one. This is the company called Ika, and we invested into that together with Peter Diamandis. This is the first time in the last 170 years when they brought a change to traditional stethoscope. In fact, this is AI-powered device which can measure a lot of things on your body. In fact, and the anecdote, it does not need to look like a stethoscope. It's only the classical conservative nature of human doctors who was like, you know what, I'm a doctor, I need to wear a stethoscope. So that's why they, in terms of their design choice, they decided to leave, this design as close to the traditional stethoscope as possible. But it can easily look like, our smartphone, and it's super accurate device in terms of doing a lot of different diagnostics. So the next sign is about gene editing and gene therapy. And when people ask me, Sergey, what is the main thing which will give us the ability for transformation of human race and our ability to live longer, healthy, and happy life? in the next 10 to 20 years. I'm always talking about gene editing and gene therapy. And a year ago, we invested in a company called Tessera Therapeutics, and we just had a meeting with the CEO and the founder of this company. Amazing thing, they invented something which is 10 times more powerful than CRISPR. You probably know that CRISPR is so-called genetic scissors. It can, cut down some of the genes from our DNA. But the problem with CRISPR, it's actually a leave to Mother Nature and its forces to for DNA to repair. And sometimes it can be off target, which means that it can do wrong genes. Tessera use something which they call mobile genetic elements. And the beauty of this technology is they can actually change and rewrite the endless amount of genes in our DNA. So that's the opportunity to treat and prevent as many diseases as possible. This is another fundamental technology which is going to change the world. And I'm really proud we, through work of Longevity Vision Fund and many other investors supporting this development. Well, number 4 is about organ and tissue regeneration. And when we talk about this, I'm always thinking about the old car metaphor. So think about the old car. We've been able to expand the lifespan of the old car simply by replacing the spare parts. You can even replace an engine, right? So that's the opportunity for you to even drive something which was built 50 or 70 years ago. Similar things will happen with human body. And that's why you have a number of avenues how to produce organs for replacement. You can 3D print organs. You can use different animal material to produce organ for replacement as well. Probably pigs, they much closer to us in terms of their DNA composition. You can reprogram cells or you can even regrow new organs inside our bodies. So here is the story. It's on the left side of the slide of the company called Ligenesis. We invested in Ligenesis 2.5 years ago. And what they do, they take donor liver, they split it in 50 to 75 pieces and use each of these pieces to help a patient. So right now, we have 117,000 people on the waiting list for donor organs in the US only. People wait for like 6 to 12 months. People die trying to, just wait for the donor organ. So here's the opportunity to use one liver to help to solve 75 problems, to help 75 patients. So they put this nucleus of the liver in your lymph node. It's actually here. This seems to be like the best place to regrow the liver. They use the stem cells to support regrow. And then in the course of 3 to 6 months, your body actually regrows like a liver tree, which support the function of people with terminal liver disease. Amazing technology. I'm so excited. In 5, 10, 15 years from now, we're going to have a lot of options to replace some of our organs and therefore extend the lifespan of our body and mind. Funny enough, 2 most difficult organs to replace and regrow, obviously heart and brain. Then number 5 is about early stage cancer diagnostic, and I'm so proud that we actually live in a unique time. We're right in the middle of winning the war against cancer. So think about 30, 40 years ago. If someone had cancer, he or she would die in the next 6 to 12 months. Right? Cancer was kiss of death. Well, not anymore. Thanks to technology, which is obviously used with full body MRI, used by HLI, any other clinic who provides advanced medical screening, but also thanks to early cancer diagnostic technologies and solutions which are under development. 4 years ago, we invested in a company called Freenome, and what they do, they use a blood test to see the signs of early cancer, different type of cancer. Right now, they can do diagnostic of up to 7 different types. They have up to 50 more cancers in their portfolio for this test. So this is the opportunity for you to do cancer diagnostic almost like every quarter when this type of test is going to be online and going to be available, and therefore to minimize your risk of cancer development from the earliest stage. This is just the first step in a diagnostic chain. So it's usually, if you know any risk, you would need to reconfirm it with more traditional, conservative, classical methods. But I think it's just a good first steps for all of us to manage the risk of early cancer diagnostic, and therefore, you know, continue to win the race against cancer. Number 6 out of 7, and I'm really excited about this whole thing. I mean, it's pretty clear that in 5, 10, 15 years from now, what I call in the book the near horizon of longevity innovations, we're going to see drugs, completely new class of drugs, and these are the drugs which would fight aging. Do an experiment, go to CVS or Walgreens or whatever the brand of the pharmacy that you have in your country, and ask them for a drug against aging. So they would think you're crazy, or they would just send you to the cosmetics, or will send you to supplements. So that is what is happening today. But what is clear, with the help of artificial intelligence, more and more drug candidates are coming into trials, and it's easily I can easily imagine that in 5, 10 years from now, we're going to go to pharmacy and we'll have prescription for anti-aging drug. It might be a drug which is developed with the help of artificial intelligence, because artificial intelligence is so helpful in terms of compressing drug development cycle. Here is the example of one of our portfolio companies called Insilica Medicine. So they've managed to compress first 2 years of drug development cycle into 2 months, simply combining artificial intelligence and human intelligence. Or it can easily be drug which will be repurposed for this case. We all know that metformin and rapamycin are good old drugs, which can easily be approved as anti-aging drugs in the next few years. So here we have Nir Barzilai, a very good friend. He's on scientific board of Longevity Vision Fund, who's actually working with American Federation of Aging on starting the first FDA-approved trial of metformin as something which can be used as an anti-aging treatment. We still don't know whether it works for people with diabetes only or for the broader population, but I think it's exciting. And the funny fact is actually metformin for this trial is few times cheaper than placebo pills. Can you imagine that? And finally, and this is, you know, I know it sounds a little bit crazy, it's 20, 30 years down the line. What's going to happen? Humans going to be augmented. So it's going to be man and machine, it's going to be integrated. We tend to think about human biology as simply like a biological problem. And the biological view of human body and mind will be complemented with technological view as well. So all of these things are already in development, like artificial body parts, human brain AI integration, nanobots. We've seen number of nanobots company in MIT today, which are early stage of development, but working on extremely small bots who can just use our blood flow and, you know, target cancer or do diagnostic, etc. And we obviously, you know, go into the world where like a material reality going to be complemented with virtual reality as well. But again, we would need to solve a lot of ethical and regulatory problems going down with that. But this is just an aspiration. Yeah, that's it. Just a few words about what we do in Bold Longevity Growth. I've been blessed to work with one of the brightest minds on earth. Again, spending the time with George Church tomorrow, amazing man, who was actually one of the initiators of Human Genome Project. Remember, it took us 19 years and $3 billion to sequence one human genome. So I don't know, David, you know better, but it's few hours and like $200, $300 to sequence human genome these days. It's amazing. David Sinclair, professor in Harvard Medical School with us. Peter Cromer, the guy who's done a lot for the aging science, because he was one of the initial inventors of the frameworks called the hallmarks of aging. Our audience is probably aware of that, and we're very proud to work with him. And I told you the story of Nir Barzilai is working on, hopefully, approval of the first anti-aging drug in the US and all around the world. We do invest in a broad spectrum because longevity is still a new field, so you need to be diversified. Gene editing, gene therapy, like we invested in a company called 4DMT, which is the largest library of viral vectors in the world, serving this kind of gold rush of gene editing, gene therapy revolution. We invest in affordable and accessible diagnostic devices like this digital stethoscopes and ultrasound devices as well. We invest in use of AI for drug discovery, companies like In Silico Medicine or Vala Health as well, and organ regeneration. So I'm very excited about what we do. I told you about the book. I told you about HealthSpan X Prize. We finally raised all 100 million, which is needed to start this pro bono competition. And in the next few years, hopefully we'll find a way to reverse our biological age, if not by 20 years, but at least by 10. And if you want to learn more about our work at Longevity Vision Fund, or want to be part of it, feel free to reach out to me or to David, and we'll connect. But otherwise, we stay healthy and happy. And remember, as I always say, the most important part, the most important day of, how do I say that? The most important day every year of your life is not your birthday, is the day of your medical screening.
Yeah. Well put, Sergey. Thank you so much. I know our audience and attendees will have a lot of questions for you. I have a couple before we get started.
Please.
I do want to, I'm not a shill for your book, but I really love this book, and so I want everyone. Actually, let me turn this around. It's I think I've got it backwards.
Yeah.
But anyway, if you missed the 7 slides that Sergey was able to show, it's captured in the book, and I encourage you to buy the book and take a read. So listen, I do want to give our audience, we have a number of questions already percolating up, but I have a couple for you as well. And the first is, you and I have given some talks together, and increasingly when I give a talk on precision medicine, longevity performance, and I show slides similar to what you show, one of the questions always at the end is, okay, well, that's great, all the theory, all the big picture stuff, but, tell me what you do for longevity. Mm-hmm. Tell me what are the 1 or 2, top longevity hacks, right, that are going to give me an additional 10 plus years of high vitality living, high performing living. And of course, I've got my answers for those, but I'd love to hear your, maybe 1 or 2 or 3 kind of top sort of personal hacks,
Okay. Well, let's talk about this. So look, it's a longer answer than just 1 or 2, because, and it's usually like people would ask me like, Sergey, just tell me one thing, just one thing. And the beauty of human biology, there's no one thing. So when I talk about this, it's in a book, it's called 10 Longevity Choices, but we can just cut it down to 5 very quickly. Number 1 is medical screening is extremely important, right? And when I have like 30 seconds, I just send people to do medical screening. Yeah. And funny enough, we spend on our cars more money than we spend on our health. And this is ridiculous. Okay, so we need to stop that. Medical screening. Number two, you need to measure to manage the risk, like, just don't do stupid things like, smoking, always using the seat belts, and, not driving motorcycles, which is 17 times more mortal than there. And people think it will happen with someone else, right? But funny enough, we still need to take care of our own kind of safety and security for us and our families and our friends and colleagues. It's extremely important. Number three is about diet. There's a lot of disagreement in scientific world what actually extends our life, but there's only one agreement: the caloric restriction, with obviously at 3 to 5 healthy and happy years to your life. And then it's your personal choice. How do you restrict your calories? How do you decrease your calorie intake by 15 to 25%? So you can go fasting, because it takes out the calories from your routine. It can be intermittent, like a window fasting. I do 36 hours fast every week. I just find it really easier to fast in the beginning of the week, and then have a more relaxed diet. You can switch from heavier meat and fish to vegetables, because vegetables have 3 to 5 times less caloric intensity. I'm not advocating, I know a lot of people who are not vegetarians, right? And I'm not vegetarian itself, but I'm very selective. What are the sources of protein they take? You obviously can cut down the sugar, because sugar is just piling up all these calories, right? To your diet, with a lot of negative effects as well. And I can go on and on in terms of, like, number three is a diet. Number four is exercise. And we have this binary view of exercise. So it's either I'm like, sitting at my home watching football on TV, right, or on the internet, or I just need to do a marathon. Well, there's something in between. We don't need to be like extremely, and we don't need to be binary about this whole thing. Like 10,000 steps a day, 7,000 steps a day should work. And on top of it, it's obviously stretching, like yoga or Pilates. It's cardio. You would need to have at least 90 minutes of cardio every week, hopefully split in 2 or 3 days. And weightlifting after the age of 50 to 60, I think weightlifting is important in terms of, like, protecting your bones and skeleton. I think it's important. And number 5 is what I call the peace of mind, which is sleep. Yeah, I as I mentioned, I use Oura Ring to establish the feedback loop for my sleep. So every time, every morning, I just look at the statistics and, like, see what have I done to my sleep numbers to be great or awful, and I kind of learn the lessons from it. And simply just having a purpose in life, sharing more than you give with the planet and people around you. Being a happy person always help. People, think about this: people with a mission, who loves life, would always radiate, live longer. Think about some spiritual leaders like, Dalai Lama or Pope. It's always helpful. But also, we can go into supplementation route. We can discuss that. And what I like, there's a number of supplements I call longevity supplements, which hit the market in the last 5 years. It was not always the case. Before that, you have your, like, vitamin D, milk thistle, omega-3, all the things.
Oh, great. Now, thank you, Sergey. I'm sure our audience enjoyed hearing those. I have one other, and then feel free, folks on the Zoom, to, in the Q&A, I've already teed up a number of questions, but if you have questions for Sergey, I'll sort of parrot them, and we can get Sergey's input. It's interesting, Sarah. I mentioned to you before our attendees joined that I just gotten back from the Middle East, and of course, there's talk all over the globe about renewable energy, and even some economies, traditionally oil-based economies in the Middle East are really re-envisioning their economies and moving away from sort of oil-based and into sort of smarter technologies. And, so you hear all around about, renewable energy, AI renewable energy companies. You can really even think about, I guess, Tesla as an AI renewable energy company. It's probably not really a battery company or a car company, but with all of the data and the cameras and sensors in their cars and the self-driving car technology. But I wanted to get your thoughts. I'm getting to my question here on, this idea that by extending our own healthy human lifespans, and if we were able to give, everyone in the planet, everyone on this beautiful planet, another 10 plus high vitality, high performing years, that's really in some ways kind of renewable human capital. With a sort of contribution to overall GDP and productivity, because you hear on the one hand, folks say, well, why do we want everyone to live so long? Who's going to take care of them? But I think the flip side to that is if we're not just talking about longevity, but we're also talking about one part longevity and one part health span, where you're productive into your 60s and 70s. No one's taking care of you, far from it. You're still taking care of other folks, right? You may still be having children at 60 or 70. You've reinvented your life. You've started a new job, a new career. You founded a new company. Imagine, now having the vitality and performance of a 30-year-old at age 70, but the wisdom of 70 years. And so I just wondered if you could sort of comment on kind of the macroeconomic possibilities of longevity.
Yeah, look, remember for the last 100 years, we doubled our average lifespan. So it was 100 years ago, it's like 35 to 40 years. And right now it's 70 to 80 years, depending on the country. And I think it's extremely important to recognize that this trend will continue. So sooner or later, we'll break the sound barrier of 122 years, the maximum lifespan on Earth, right? So there's no kind of biological limit of how many years. So we can look like, specifically, like if you go into combining man and machine and human augmentation avenue, like there's endless possibility for you to add decades to your life. I think what is important to recognize that the quantity of these changes will result in the quality of change. So, and the paradigm of our life will change completely. So right now you have pretty much fixed, you've been kid, you study, you have a work, full-time work, and then you have full-time retirement. Well, it's not anymore. We're going to have this series of mini lives. And this is how I'd like our audience, and this is where I push myself to try to rethink my life paradigm. So it's not unusual for people to have like number of careers, right? And number of passions and some complete changes. Again, it's like series of mini lives. It's whether we want it or not, it's going to be series of relationship in many cases. Even today, like 2/3 of the marriages will end up with divorce in the first 5 years, right? We're gonna see number of generation of our kids. So this is very important. You touched on reproductive health thing. So with the time, our reproductive ability will just decouple from our sexual activity and actually state of our body. And this is important thing to recognize, right? Then if you think about the planet, I don't think we have any other choice rather than improving the quality and quantity of our years. So any mathematical model of the which models the population of the planet show us that maximum we're going to reach probably 9.5, 10 billion people on this planet by 2050, and then it's going to be rapid decline down to probably 8 billion by the end of this century, right? China itself will lose 600 million people in the next 75 years, from 1.4 billion to 800 million people. And this is how demographic works. So I think it's extremely important for us to realize. And then, I mean, you made so many important points here. When I think about Tesla, I actually think about Tesla as a longevity company, because every time when you replace the human driver with computer, mortality rates from the car accidents decrease by 10 times. Think about this.
Yep.
10 times, right? So this is 1.2 million deaths that we have today on Earth from the car accidents. So they're going to decrease, by 90%. And this is the sign how environment around us are becoming more and more longevity friendly. So you just been to Saudi Arabia and NEOM, right? They designing this whole city with the premise for this city to be longevity driven, to support not only human safety and security, but also human health and healthy years.
Yep. Well, thank you, Sergey. I've got as you can imagine, a number of questions.
Please.
We won't be able to get to all of them. Unfortunately, they keep coming, but I'm going to try and filter out a few for you. Not surprisingly, any vitamin or supplements recommended?
Yeah. So look, I think about two buckets of supplements here. So one is like good old basics. I would definitely. Okay, let me use my own example. I'm taking vitamin D because we always under the roof. Like unlike our predecessors, we don't have the enough hours under the sun to develop the proper level of vitamin D. So this is what I'm taking. Vitamin D is, well, David and your team is better in that. As I understand, vitamin D can be toxic if you overdose that. So that's why I actually measure it every quarter to make sure I stay somewhere on like 60 or 70 level. So this is I have pretty high cholesterol level, and I'm not at the stage of my life. I'm 51. When I'm prepared to start to take statins. So omega-3 works, in a good way for me in terms of balancing my combination of diet changes and omega-3. So I'm taking omega-3 as well. I'm a big fan of some natural compounds like milk thistle for the liver. The last time I've seen my human longevity checkup results, and you have this scale like the liver health from 1 to like 10,000, and like mine is like 1, which is like the best liver on earth. So I attribute this to the my lifestyle, but also to milk thistle. Funny enough, like think about this: why supplements are supplement? Because they have a lot of like natural origins, like herbs and the natural compounds. And big pharma will not be able to patent that and benefit from that. That's why it's in supplement category. So you obviously need to be like super mindful in terms of the quality of the supplements and where you get it. But frankly speaking, in the end of the day, like 30 to 40% of the supplement work is placebo effect, and I'm like typical placebo man. So if I believe in something, it actually works for me. So I would recommend you to take any supplements. I actually literally go to the pharmacy, just reading through the labels and and think about what I'm using in rotation. In terms of longevity supplements, without going into details, because then it's going to become like a medical advice. I like that more and more longevity supplements are coming into the space, and obviously NMN. Seem to be like a standard for many of my biohacking and not that biohacking, like longevity friends would take NMN. So I'm taking NMN every morning, like 1 gram of NMN on a continuous basis. And there are a number of other supplements which are on the market and will be on the market, which I consider longevity supplements, can basically improve. But like, frankly speaking, like every time that you're going to receive compliments is the time when you just done your caloric restriction work. This is the best supplement. Yeah, put your body into starvation mode for a little bit, do this, mini shock, and enjoy the benefit of radiating, feeling light, and extending your health span and lifespan.
Yeah, I think that's a great point, Sergey. And by the way, if I open a supplement store, you'll be my first customer with that comment. But
Yes.
that is a wonderful comment to end with on that question, which is that we can do so much, with our own bodies, intermittent fasting, to some degree, calorie restriction. I always like to say it's important to balance that, of course, with maintaining lean muscle mass, because at the end of the day, it's not just about longevity. We don't want to just extend, Sergey, your life by 30%. We want to add, 30% more, high vitality, high performing years. in your 90s and 100s, you want to be able to climb 3 stories with 3 bags of groceries. And so keeping lean muscle mass becomes important. So I think just like everything, there's no, concrete rules. There's probably a time for building and a time for, intermittent fasting and a bit of starvation. And I think a good mix of both is probably good advice. Anyway, a few more questions here, Sergey. You touched on it, and I think we would all agree that we've seen some amazing advancements in the transplant literature, in the transplant world. Kidney transplants, pancreas transplants, heart transplants. Our former vice president in the United States is a beneficiary of a heart transplant and doing very well. But we can't get a brain transplant, right? And so brain health is so important. And when I give talks, I talk about the importance, sort of the radical reprioritization of organ health. Brain health has to be number one. We have a number of questions from our attendees about, what's your advice on brain health, or whether it's supplements or strategies or tests. Whether it's avoidance of dementia, Alzheimer's, Parkinson's. Any thoughts on that, Sergey?
Yeah, look, I actually have to disappoint you. And we don't know what we don't know about our brain. And this is the problem. Think about this. So we're starting to experience the problem with like dementia and Alzheimer towards 70 to 80 to like 85 years when we are getting old, right? And statistically, there were not a lot of people on this planet who lived to this age. Remember, I mentioned that even like 100 years ago, the average lifespan was 35 to 40 years. So in a way, we were so busy with all other diseases like metabolic diseases, with heart disease, with cancer, which we face much early in our life, around 50, when we're 50 or 60 years old. And that's why I still think we are at very premature stage in terms of understanding where it comes from, how to prevent it as well. Even like, remember in human longevity, you guys had initial tests to test like neurodegenerative decline. And then we basically decided there's not a lot of things that we can do about this. So what I would say, you just need to play for time and stay on this longevity bridge, because in 5 to 10 years, things will change. We'll get much better understanding of human brain. We actually get a lot of integration of different technologies. I've seen a lot of mind-blowing, literally, things today, even nanobots, which can go through a blood-brain barrier and treat some of the brain deficiencies. So for the brain, what I do actually is, I think the diet is extremely important, because brain consumes up to 25% energy of our energy intake. I think taking out toxins like alcohol from your diet is extremely important. And people think there's such a thing like a safe dose of alcohol. No, it's not. I mean, theoretically, you can have like a glass of wine during the evening, but this glass is just up to capacity of your liver to process that. So when so it's still poison, but your liver is healthy and it can process kind of first glass. When you go to second glass, it's already like toxic for the body, but more importantly, it's toxic for the brain. The benefits of diet. So I just had a chat with David Sinclair today. He's like, well, Sergey, I tried to be vegetarian. Again, I'm not advocating, I'm for balanced diet. He said, like, my memory improved just amazingly. The one thing which I can recommend, which I found exotic but like working, there's a technology called neurofeedback. And I'm intentionally not recommending providers. There are a number of providers in the US. I was doing my 10 neurofeedback sessions in London. I mean, it's amazing. It's almost like you've been meditating for the last 10 years, right? And what it basically does is first they scan your brain and see what are the areas of your brain which are underdeveloped or underutilized. And then they literally, like, you stare at the TV screen and they have like different type of cartoons. It looks like cartoons where with your vision and the feedback, which is still collecting through electrodes, I mean, you're just trying to manage what is happening on the screen. I've done 10 sessions, 30 to 40 minutes each, and it's actually changed your brain, your ability to think, your level of happiness, and even like your level of harmony. I don't know how it works, but I've been so amazed by the positive outcome of neurofeedback.
Thank you. I think we all share the notion that there's no health or health span without mental health. So I think those
Absolutely.
are all key concepts. A couple more questions, Sergey, and I think we're going to close right at 5. I'm sorry I won't be able to get to everyone's question, but one question, and we actually always get a lot of questions on supplements, in particular NAD precursors, mitochondrial support. We know that mitochondrial support for the brain and the heart is so important. And you had mentioned, the NAD precursor NMN. I know David Sinclair has publicly talked about taking 1 gram in the morning. It sounds like you do as well. Maybe we had a question about that from the audience. What has that done for you? Have you noticed an appreciable change since you started taking NMN? A lot of our clients, here at Human Longevity, take some of the NAD precursors.
Yeah, look, I mean, it's all very subjective. Like I felt that my performance during the physical exercise improved by like 20 to 30%. But again, human beings are very placebo driven, so you can easily attribute it to placebo as well. But I'm happy with that. I mean, if this is something that works, this is great. Yeah. So I do take NMN, and I attribute some of the positive effects in terms of my capacity for physical activity to that.
Wonderful. Thank you. I think one more question here, and it's more on the investment side. Thank you for illustrating some of the investments from your fund. And, the question is, you mentioned gene editing, a number of other areas. What are some of the, maybe 1 or 2 sort of top areas in as we move from, can you believe it? We're almost into 2024. What are some of the most interesting areas for investment in the longevity space that you're looking forward to in 2024?
Yeah, so I think it's important to realize that longevity is still pretty mature space, right? And when people ask me like, where do I invest? I'm like, don't invest. There's no company in a public stock where you can safely invest and make a bet on longevity. So we need to wait for a little bit, and that's why we are so popular with the fund, because people coming to us, at least they have exposure to diversified portfolio of like 18 companies that we build, right? But when people come to us with money, I'm like, guys, don't invest more than 3 to 4% of your wealth, because it's still very risky area. It's a little bit like, as I'm already mentioned, the crypto before. So it's too early to invest your money into longevity unless you have like diversified investment portfolio. You want to allocate portion of your money to educate yourself and hopefully make returns from longevity investments through the funds like ours or anyone else. But I think in 5 to 7 years, we'll have longevity ETFs, we'll have longevity companies in the public space. But it's early to dedicate a major part of your wealth to that, but it's right time to dedicate the major part of your personal time and focus on taking back control of your own health and be in a driving seat.
Yeah. Great. Well, one last question that dovetails on that, and I think we'll close, Sergey. The question is, again, sort of on the investment side, I think addressed to you sort of personally and your fund. Mm-hmm. Are you currently investing more in sort of the precision diagnostic space or the precision intervention or precision therapeutic space, or is it kind of a mix of both? I've always said for human longevity, if you're really going to add 10 plus years of life, high performing life, it's probably a mix of both, but I'm interested.
Yeah, it's 70% interventions and like real stuff when you can actually reverse your aging and treat a lot of diseases which are mortal, and 30% is early diagnostic.
Yeah, great. Wonderful. Well, Sergey, it's always a pleasure. And we, on behalf of our entire ecosystem, we really appreciate you taking an hour of your time. I know it's getting late there in Boston. And again, folks, for those of you on the call who haven't had a chance to pick up Sergey's book, please do. And we look forward to speaking soon and seeing you soon, Sergey.
Perfect. Thank you very much. And to
Okay.
all our audience, again, stay healthy and happy. And thanks for the opportunity to spend this hour with you.
Thank you, Sergey. Bye now.
Thank you. Bye-bye.